My name's Tainsh, for those of you who don't know me. I know quite a lot of people in the room. And I'm currently the professional lead for Scotland for Baby Friendly. This post is funded by Scottish Government to support the implementation and the maintenance of the Baby Friendly standards across healthcare services in Scotland. Currently, as Linda said, the Scottish Government are also providing financial support for neonatal units for them to achieve accreditation of the Baby Friendly standards. So I'm going to start with just a brief overview of the work of the Baby Friendly in the UK, followed by an overview of the standards. So Baby Friendly Initiative is a joint programme of UNICEF and the World Health Organization, which was designed to address the global decline in breastfeeding. Breastfeeding rates, as you know, in the UK were some of the lowest in the world, and there was work being done across the UK by groups with expertise, and lots of effort was being made to increase breastfeeding rates. The Baby Friendly Initiative was introduced in 1994, and the programme helped to pull together the work that was being done, and along with the implementation of the 10 steps to successful breastfeeding, routine practice in maternity services started to change. Skin-to-skin contact at birth, mothers and babies rooming in together are two examples of practices that have changed and are now embedded in maternity service care. The Baby Friendly Initiative programme is based on the United Nations Convention of the Rights of the Child, the world's promise to give every child the best start in life. The CRC is at the heart of all the work that UNICEF do, and improving the care and experiences of mothers and babies throughout the healthcare system is crucial to the Baby Friendly Initiative programme. Following the launch of Baby Friendly in 1994, as I said, practices began to change in the UK, and then standards for care in the community were also introduced. Most of the relevant services across the UK are now on board. In Scotland, all maternity services are Baby Friendly accredited, almost all health visiting services, over half of the university programmes, and a number of neonatal services are now engaged in the process, with a few very close to being accredited. To build on the good start within the UK, look at the outcomes and consider emerging evidence, a review of the evidence was carried out in 2012. A wide body of experts, including leading academics, contributed to a holistic best interest of the baby review. Evidence was included from medicine and allied fields, neuroscience, child development and health promotion. The resulting document is a broad and comprehensive review which has been endorsed by all 4 Ministers of Health in the UK. As a result of the review, the Baby Friendly programme was expanded to take a holistic approach into how feeding fits into the wider picture of parenting and relationships. The review also opened the opportunity to develop standards specifically for neonatal units, with the aim to positively influence care in neonatal units and to bring the same principles of holistic care to support relationship building, parenting and feeding to the fore in situations where parents and babies are vulnerable. Neonatal units have traditionally been about survival. There's an increasing understanding that after survival, the most important thing that we can do for the positive long-term outcome for any child born prematurely or ill is to support their relationships. Food fits into both of these categories. Firstly for survival, but a close second about relationships, most notably with their mother. It's recognised that there's been a lot happening across neonatal units to support this, including the work of Bliss with Parents, Best Beginnings, the Neonatal Care Collaborative and Baby Friendly supporting breastfeeding. However, it has been inconsistent across units and between staff. The Baby Friendly neonatal standards were developed following the review, extensive consultation and piloting. The responses from parents to the pilot greatly influenced the final standards, which pull together the positive work being done, the results of the consultation, and link the care to standards which provide a structured approach with the aim of improved outcomes for parents and babies consistently across services. The standards keep mother and baby at the centre and link each of the 3 standards to support the provision of holistic care. So much is happening to support parents to build close and loving relationships with their baby, including things like containment holding, skin contact, kangaroo care, family involvement, support from staff and developmental care professionals working alongside to support parents. This is all so important for parents who who often feel scared, anxious, and sometimes out of control in the situation, but even more so for the babies who are a long way from the warmth, comfort, and protection of their mother's womb. It's hard to overstate the importance of very early relationships for every human being's future well-being, which will affect their entire life. Parental love is often assumed, and mostly this is okay. But as health professionals, we are present at the most crucial times. The meeting, the falling in love, and how we support that really matters. What we can do is everything possible to nurture and facilitate love and give it its real value as the single most important thing after survival. The vast body of evidence to support the benefits of breastfeeding for women and babies is widely known. The recent Lancet series provided detailed analysis of the evidence and highlighted the importance of breastfeeding as a public health issue. The value of breast milk for premature and sick babies is of particular importance. Premature babies miss out on the huge transfer of immunity in the last trimester of pregnancy, including secretory immunoglobulins. We know that mothers produce the right milk at the right time for their baby, and when a mother is with her baby, she's constantly updating his immunity in response to infections that they're both exposed to. Babies in a hospital environment have an acute need for this added protection for their mother's milk. What is equally important is that breastfeeding promotes love. Physical contact between a mother and her baby release huge surges of oxytocin in the mother to bond her to her baby. High levels of oxytocin in the baby have benefits in terms of enhanced brain development. There are many positive things happening in neonatal units to support mothers. There's a drive to raise awareness in parents of the importance of breast milk for their vulnerable baby and to support mothers to express milk. Greater understanding has led to early and more frequent expression to stimulate supply. Mothers are taught to hand express. There are good pumps available with funnels of different sizes which help to increase the efficiency of expressing. Some of the focus for this standard is around the provision of individualised and regular support. This is vital to support mothers with the challenges of expressing long term and to help them make that transition from expressing to breastfeeding. These challenges require skilled staff and effective procedures to ensure the support provided meets each mother's individual needs. To support standards 1 and 2, close relationships and breastfeeding, parents need to be with their baby as much as possible. To enable them to be there, changes may need to be made to the environment and to the attitudes of staff. Parents need to feel as comfortable as possible with some ownership of space. It may be as simple as a comfortable chair to call their own, somewhere to put their belongings. Parents do need to feel that they can be with their baby whenever they want to be, and to understand that this is a vital part of their baby's welfare. Parents also need to be aware of the care their baby is receiving and to be involved in decisions being made about their baby. This standard aims to support the development of a culture and practice that truly reflects the fact that just after basic survival, the psychosocial care of babies is the most important thing for their health and well-being, and parents as partners in care are essential for this outcome.
With my first baby, I felt I was his mother the day he was born. With my second, it was the day he left the neonatal unit.
For all this to work, staff need support to build their skills in recognising the different needs of parents and then supporting parents as they take on the responsibilities of caring for their baby. It can be challenging for staff who have always done the caring to change to a role of teacher, supporting and encouraging parents as they learn, helping them to recognise the positive effects that the close contact they have with their baby makes a difference. It can be very obvious, from the improvement in a baby's oxygen saturation when it's in skin contact, to the more subtle, as in the relaxed and calm posture or other positive responses of a baby when mum and dad are talking or singing to him. If parents have some ownership of space to be with their baby, staff also need access to space that they can call their own and the opportunity to share experiences and learning. There is a clear and supportive pathway towards achieving accreditation with the neonatal standards, beginning with having policies and procedures in place to support the standards at stage 1, training for staff, following which the staff's skills and knowledge are assessed at stage 2, and when audit shows that this has been translated into improved care for mothers and babies, parents' experiences assessed at stage 3. There are courses, resources for staff and parents, and an audit tool to measure progress along the way. Finally, the standards are the umbrella which overarch a holistic approach to care, resulting in the psychosocial care of babies being second only to survival in terms of how important it's regarded in each unit. Each standard will support and enhance the other. Nurturing close and loving relationships will support breastfeeding and consideration for parents' needs. Breastfeeding will support survival as well as relationships and parents' right to be with their baby. There's lots of good work going on. However, achieving baby-friendly accreditation joins up all these areas of work and sets the bar higher. It's an umbrella for everything else. This results in holistic care that improves the outcomes for mothers and babies so that they have the best experiences possible. Thank you.
Thank you.